Should someone be tested for the weird little bugs, mycoplasma and ureaplasma, when there's burning and persistent discomfort, but everything else seems normal? So mycoplasma and ureaplasma are weird bugs in that they don't even have a cell wall. They're often present in the urinary system in folks who are having no symptoms. So what we do with them is a little bit of a conundrum. So there's ureaplasma and two variants of mycoplasma we should know about: Mycoplasma hominis and Mycoplasma genitalium. So ureaplasma is part of the microbiome in 30 to 70% of sexually active adults and causes no symptoms in the majority of cases. Mycoplasma hominis is probably present or colonized in about 20% of folks, but Mycoplasma genitalium seems to be a true pathogen. And by pathogen, I mean that it wouldn't be present in a normal urinary system. So as I stated earlier, these are what we call atypical bacteria, meaning that we can't culture them on normal culture media. So we have to do a DNA-based test called PCR. So when do I test? If I have someone who has a normal UA, normal urine culture, but has persistent symptoms, I think it's very worthwhile to check for mycoplasma and ureaplasma. And even though it is controversial about whether these can cause symptoms, in a patient who has persistent symptoms, and I find these, doxycycline is very effective for ureaplasma and Mycoplasma hominis, and I've anecdotally seen people get better. Mycoplasma genitalium probably needs more aggressive antibiotic treatment, but luckily the PCR usually tells us what antibiotics to use as well. Like a lot of things in medicine, the waters are a little bit muddy about this, but I think it can be useful to test and treat.